I'm going to start with a couple polls. Okay. Okay. So, thank you very much for your patience there. Just having my phone line go blank was disconcerting. But the Moving on Maternal Depression initiative through CLASP is a collaboration with states to advance policies that improve maternal depression prevention, screening, and treatment among mothers with young children. Here in New York, we've expanded that to look at maternal mental health more broadly. CLASP is providing technical assistance to a cohort of 3 states, New York, New Jersey, and Pennsylvania. Each state has its own unique goals to help mothers with maternal depression. In addition to the technical assistance to these 3 states, CLASP is also providing peer-to-peer learning opportunities through a community of states to strengthen maternal depression policies and systems, including Medicaid, mental health, early childhood, and human services. In New York, we've created a work group of women with lived experiences, and this Voices work group is informing the work we're doing and ensuring that we are focused on ideas and policies that address what they have encountered in different systems. Because so much of the work on maternal mental health is already underway in New York, the MOMD project is seeking ways to better integrate policies and information across state agencies and with partnerships at the community level. One of our policy focuses is considering what key metrics can be used to better understand the scope of maternal mental health and implement continuous improvement activities across state agencies and through healthcare providers and community-based organizations. In a related goal, this project is seeking to understand capacity in each region for screening and treating women with maternal depression and other maternal mental health diagnoses. This will help aid in developing a plan focused on workforce capacity. And this is what we're considering today and where the Continuum of Care will help us think through that capacity. The National MOMD project, as well as our state project, are predicated on ensuring that there's a racial equity lens focused on each goal. So we've also created an equity workforce that is providing us with that expertise. Before I go any further, I want to point out that if you navigate to the Schuyler Center's website and go to the Issues tab, and then find Health and go to Maternal Mental Health, you will find a PDF that's labeled MOMD Continuum of Care under a heading for today's webinar. I'm going to walk through that PDF today, so if you don't get to pull it up, that's fine, and I'll show information again on how you can get to that. But if during the presentation you wanted to be able to pull that up and follow along with us, you can. I also want to let everyone know that today's webinar is part of a larger process by the MOMD project to help develop a better understanding of policies and strategies to improve the continuum of care for maternal mental health, and your input is valuable to that work. However, because it turned out that a lot of people wanted to be on today's presentation, for which we are very, very grateful. And we had to change our strategy a little bit for how we can gather input on this webinar. And I'll explain that process in a minute. What I'm going to walk you through today is a series of worksheets representing critical time frames when providers in various settings should engage with women to address maternal mental health. We have compiled the spreadsheet based on previous work on maternal mental health that was done in New York, research on models from programs in New York and from other states and other countries, and with input from our Voices work group of women with lived experience. Some of the principles that we've considered as we've worked on this draft are that education on maternal mental health should be universal, available in many settings, and education should be appropriate for women, partners, and other family members. And that ideally women should be assessed for mental health conditions prior to pregnancy, but that screening should be offered and available in every stage of a woman's life. And that treatment options, both modality and setting, should be available to all women depending on their preference and their needs. So as I said earlier, we had a tremendous interest in today's presentation. So we worked out what we hope will be the best way for us to gather input from such a large group while allowing you some time to think about what it is you want to contribute. First, I'll walk you through each stage of the continuum, giving you some time to review the section on the screen or if you open the PDF from our website. Then I'm going to have several questions that I will pose to the group. And I invite you to put your responses in the, to these questions in the chat box, which will be open for everyone to view. I'll give you some time to do that, and then we'll see if we can provide a quick summary. And please don't feel like you have to respond now if you want to take some time to think about these questions and what you see. All the materials and a survey for feedback is on the SCA website, and I'll show you that information at the end. And so you can take your time to respond, look at the material, think about today's conversation, what you're seeing in the chat box for feedback, and then you can respond whenever you have some time to do that. We are going to save the chat box responses and compile those with the survey responses. And today we'll give us sort of a top-line reaction to this work and help us identify what we missed, where we need to dig further, and gather additional information. You will see that we're at a very high level for the continuum, and this is the beginning of a work in progress. You're helping us to refine the direction of this product. This will not be your only opportunity to respond to the document. We'll be back later in the spring with another version, and we expect this to be an ongoing process. So right now I'm going to open the share. Okay. So we've, as you can see here, we've broken up the continuum of care into the different periods of a woman's life when she might encounter these services or need for these services. And we've broken each section down by informing and then referring, and then in some of the other screens you'll see screening as well. So I'm going to give you a minute to look this over. Just give you a minute to sort of see what's on here now. Yeah, you haven't lost audio again. I was just giving you a chance here to take a look at what was on the screen. So our goal is to engage as many diverse communities as possible with a focus from underrepresented minority communities. For example, African American women, refugee and immigrant women, Medicaid eligible women, other groups that might be underrepresented. And so with that framework, I want you to take a look at the provider and location sections that are in this sheet, and let us know what other providers or locations we should be looking at as places where women seek services or where women receive pregnancy-related care. Who are women reaching out to for help that we should be looking at as other providers that might be able to engage hard-to-reach communities and families? PSA. Oh, public service announcement. Somebody asked what PSA stood for. That's public service announcement. Okay. So, okay, WIC and doula, I see that on this page. I think we've included them in some of the others. All right, so as part of the informing piece. Okay, religious organizations, that's great. Social workers, yeah. So I'll give you a couple minutes to think about this and respond. HS classes, Natalie, if you could tell us what you meant by, oh, schools, libraries, great. Police stations, nice one. Okay. All right. So while you're thinking through that, the next, EAPs, yeah. The next one is take a look at the activities section. Continuing to think through the equity lens, do you think that these activities will help the women we are discussing? And do you foresee any barriers or challenges to implementing these activities? So would there be additional activities we would need to include, and what do you foresee as barriers or challenges? I'll just give you a minute to think about that and to post. If you also want to be jotting down your own thoughts so that if you navigate to our survey in a little while, you can, post the same comments there. Don't feel like you need to, put everything on this. Giving you a chance to just throw ideas out and see what others are thinking. Okay, so yeah, we got some great. Okay, yeah, we have to. I think we have a comment here about making sure that the providers know what the services are. Okay, we're going to be navigating to that section in a minute. We'll have more comment on that. If we're just looking right now at sort of the more general. Okay, this is really helpful information. Language translation, good good point. Thank you. Okay, now I'm gonna segue to the next section, our preconception section. And I want to ask you the same questions. And that is thinking about that same population again, underrepresented communities. Let's take a look again at the provider and location sections and give us an idea here too about who we're missing and places that we're missing where we would need to reach and engage hard to reach women. I'll just give you a minute to look at this and give that some thought. Oh yeah, oh, food pantries, okay. Yep, great. Employment center is nice, okay. So I'm going to ask you again to look at the activities section on here and continuing to look through that same equity lens. Do you think that these activities would help the women we are discussing? What barriers or challenges would you foresee in implementing these activities? And what kinds of things in this section under preconception? Now, this is our focus at the moment. We can look at other sections in a moment. Just in preconception care, where should we be digging in a little deeper to learn more about where women can receive services and what kinds of activities we can implement? I'll give you a minute to respond. I see, Margot, you have a question. Why would the ones under screen not also be under inform and educate? Oh, I see what you mean. Why would you? Okay. Okay, you're right. Yeah, we could be. Yep. Yep. We shouldn't be cutting out the screening in the inform and educate. Correct. Okay. I think we can try to figure out a better way to represent that. So what important activities in this section did we miss? So you have a lot of experience looking at these at this work. What important activities did we miss? What do we need to add? And I'll give you some time to think about that in the chat box. Oh, medication safety and pregnancy. That's great. Okay. So I'm going to navigate to the pregnancy section here. And we're gonna sort of go through the same exercise. So take a look at the provider and location sections and give us a sense, again, with that same frame, what other providers or locations should we be looking at as places where women seek services? Again, this is a pregnancy section for pregnancy or are receiving care. And where else might we be looking to ensure that we're reaching the right providers that are engaging hard to reach women? I'll give you a second to think about that and just sort of look this over. Any other thoughts around pregnancy and hard to reach population? Oh, public. Okay. Great thoughts. So we'll take a look again at the activity section, and we'll think about this again. So continuing to look through that equity lens, do you think these activities help the women we are discussing, or what are the barriers and challenges you foresee for implementing these activities? I'll just give you a minute to think about that. I know this is a little more, a little trickier trying to read the activities. And so based on your experience and the work that you do in the communities, what important activities have we missed? Okay. So Elaine, you have a comment there that providers do not see the need. That's interesting. Maybe you could drop a couple of sentences to let us know what you mean by that, and then I'd love to have a longer conversation. Okay. Involving families. Well, that's one of the conversations that, and we'd like to have people fill this in when you get a chance to really look at the PDF and focus on it. But if you can let us know now, or even in the supplemental feedback, where you think we can engage family more, that would be great, because we have been focused a lot on women, but our conversation in our work group has really thought about where do we engage families more. So any suggestions about where we need to insert either new activities around families or ensure that families are included in the work would be terrific. Okay, Elaine, nice. Okay. So if there are activities that we've missed, you can let us know that now, and in addition to the barriers. Okay. Yeah. Okay. So we're seeing a lot of suggestions about engaging families and thinking about where engaging fathers. Fatherhood has come up quite a bit. And then really addressing other social determinants and supports, so thinking outside of pregnancy and what other needs the family would have that need to be addressed as part of this, which is really great. Yep, having materials that families can look at together, and create messaging defining what support would look like, so families would know what to do and how they can be helpful. That's great. That's great messaging piece that we want to make sure that we get in there as well. We see a lot of comments coming in around coordination between multiple systems. I think that's great. We want to make sure as we think about this, if there's ways that we can consider we're calling this a continuum, but we don't want to make it siloed, right? So we want to think about a continuum, both sort of vertical integration as well as horizontal integration. So within the care the woman gets, and then across the different phases of pregnancy, and then also within the different service components. So we're looking at a multiple ways of a continuum. So that's very helpful. Yeah, support groups. A lot of people are talking about support groups at the local level and giving us some suggestions about what those support groups are, such as lactation support, baby cafes, other community libraries have come up, parks, other types of places like that. Shelters have come up several times. I think that's great, and I think we need to have a conversation about the special needs of women that are in shelters. That's a great suggestion. Okay, so I'm gonna flip now to the next phase of the pregnancy of our continuum here, and that's inpatient. And we've grouped this as high-risk pregnancy, immediate postpartum, and NICU. And for some reason, and so we'll ask the same sorts of questions. If we're looking at that same lens around engaging diverse communities, if we look at the provider and location sections, where should we be looking to make sure that we're engaging hard-to-reach women? Give you a minute to just look at this one. All right. Grocery stores, public bathrooms, parks, hospitals. Yep, hospitals. Yeah, good place to engage. apps, right? Technology. I think somewhere in here we had technology, but it wasn't the. I think we can include technology more generally across a lot of these. Women, trying to find women who aren't ready to seek counseling information. That includes where to seek help and developing a plan for follow-up. Yeah, so that's great, and we need to figure out, where that information becomes housed. That would be really helpful. Yeah. Okay. Yeah. So great. And so we'll ask you to do the same comments around the activity section from the previous one. So based on that same equity lens, do you think that these activities help women in this this phase, the inpatient high risk phase, in terms of are these the activities to help women, and what barriers would you foresee in this phase for implementing these activities? I'll just give you a minute to look at that. Okay. Any? Yeah. Barriers, cultural differences, and how they're presented. Yeah, I think that's going to have to be, as we dig down into this, past this version, and we get into some of the more specifics around these activities. I think those are the kinds of questions we're going to really have to come back to this group and get some more assistance on. So that's really helpful to know. Your suggestions on that. So anything on this one we haven't covered in other sections, or even if we covered them in other sections, if you feel they should be here, we should understand that as well. Behavioral health is not well integrated with medical health providers. Yeah, that's an important barrier. I think that's one that hopefully we can start to think about addressing, and we may be reaching out to folks for more suggestions on those types of activities. I'm just going to give people a few more seconds to think about this piece, this section. Yeah, most of the comments could be used across the life course, altered slightly as needed. Yeah, you're correct, Cheryl, on that. And we're trying to figure out how to do that without seeming so redundant, but at the same time be really representative. So also, if there's anything that is specific to any of these sections, we'd want to really capture that as well and highlight that and make sure that we dig into that. Community workers, yeah, peers with common experience, yep. So under activities, are there any, so we had a comment here about community health workers and matching with peers with common experience. If we looked beyond community health workers as providers and locations, are there any specific sets of activities that we should be considering that are done by community health workers and peer support that are not captured in the activities section? Anything that they might do, others might not do, that we'd want to make sure is represented in activities? That would be useful to know. There's another, somebody else mentioned support groups, NICU support groups. Yeah. So if we can think of, other activities that could use providers in a different way, that would be useful. I'll just give people another second to look at this one. Training of approach to administering screening tools. Okay. Okay, so we need to be thinking, as we start to look at competencies for the providers that we're trying to capture in this work, training for administering screening tools would be part of that. And I think the point here is also the approach to administering the training tools is critical, not just administering them, but the approach. So I think that's important. And that, I think, might be sort of one of the activities that is different or could be pulled out differently for community health workers and peer support. So that's useful. Okay, so people can still have opportunities to respond to this at another time, later. But we're going to move on again to the our final segment of our continuum, which is the postpartum. And again, you'll see many of the same providers and same locations that we've talked about before. And so if I'm just going to give you a minute to look at this. Oh, somebody suggested a program called Boston Basics, community school system invested in outreach programs. Okay, so that's a program that we can investigate. That's great. Thank you. Anything like that you want to throw out there, we'd be happy to take a look at as part of our research. So again, we're going to take a look at the same sort of set of questions. So look at the provider and location sections and give us a sense of where we're missing or where you feel we could be looking at the types of providers that would engage hard to reach women. I'll just give you a minute to see if there's anything. Again, even if it's replicable from earlier, if you feel like it belongs here, please let us know so we can ensure that we're filling in all the gaps. We'll try to do a crosswalk again to make sure that we're including providers across these various segments, but if you think that there's something particularly we're missing, please let us know. Oh, early childhood providers, that's important. Okay. Oh, okay. Thank you for letting us know that Boston Basics has been implemented extensively in the Hudson Valley. That's great. We'll be reaching out for information. Thank you. So take a look at the activities section and we'll ask the same questions. Continuing with the equity lens, do you think that the activities that we've listed here are the correct ones for reaching hard to engage women? Should we be adding to this? And do you foresee any barriers to implementing these activities? Even if they might be replicable from ones you've given us earlier, that's fine. Or if you think there's anything in particular about the postpartum period that would create some barriers to these activities, that would be helpful. So I'll just give you a minute to think about that. anything particular about the postpartum period and services that you think we should understand or know as part of this? Okay. Behavioral health providers not sensitive to the delicate bond. Okay. Okay, so we need to be focusing specifically on the dyad at this point and making sure that we're including activities around the dyad, which that's helpful. Other treatment categories. Yeah, somebody has a question here about what other treatment categories, and if there's anything you think we should be breaking out in terms of treatment into multiple activities, or we've lumped too much together, you can let us know. That substance abuse, yes, yes. I think that's a treatment section that we can add specifically across this whole section. We can be thinking about how we focus the substance use disorders treatment into this. And if anybody, and also with referrals and screenings, if there's anything that you think we need to be adding across the lifespan with, or across these activities with substance use disorders, that would be helpful. Okay, all mental health disorders. Yeah. Okay, so we need to, I think we've pulled that language from other people, but I think we need to broaden that. I think that's a great opportunity. Cost and treatment again, insurance. Oh, child care while in treatment. Okay, really useful to know. Sexual abuse survivors is a different sort of category. Okay, that's really helpful. Yeah, somebody has mentioned that we haven't included substance use disorders, both sort of in terms of treatment, but I think we need to be thinking more inclusively about how we represent within the continuum. This has come up before, the barrier of cost and insurance for treatment, and the stigma of maternal mental health. So I think, if we go back to our Across the Life course, we need to be focusing on the stigma. I know that we've raised that a number of times in our work group meetings, but it's nice to know that that's reflected, and we need to be really digging in on what that could mean. Child care while in treatment, that's a great barrier. It's something that we can be thinking about. Trauma-informed care, okay. There's some information here about trauma-informed care. We tried to capture some of that, but I think you're right. I think we can dig a little deeper on trauma-informed care and think about what the activities and the providers are for that, and how we are more representative of that in this continuum. Yeah, open seats. I think somebody has raised the issue of treatment, accessibility of treatment spots, open spots. I think that's one of the things we're trying to really dig into with this, and I really appreciate that comment, is that once we're trying to identify sort of what are our providers and activities that we're looking at more globally, then we can start to look at what the data tells us about where people are located, what types of services are located, and start to figure out where we need to grow services as a state. So that's great. That's kind of thing that we're aiming for with this, right? Give us a sense of what we need to be doing next. Access to community support groups, that's great. I know that one of the issues we've talked about, it's been raised before, is reimbursement or funding for community support groups. So I think that's important to think about as we're talking about ways to reach women. Is what does that mean? What does that look like? Right, yep. So there's a comment here around the issues around engagement in child protective, and what does that mean for families. So I think that that's useful to consider when we're thinking about activities and who we need to engage. That's great. Okay. Oh, care for children with disabilities. Oh, that's something we had, plans of safe care. So, and okay, So this is all really, really helpful conversations. This is great. So I'm going to navigate back to the slides here. I'm going to ask you a last. Oops. Hold on, I'm still here trying to make sure I'm actually sharing. Okay, share. Okay. Share, okay. So our last slide here, you can see that there's the information again on where to get the materials. The recording will be posted before too long once we process this. And there's also a survey for input. My contact information is on here, and please feel free to email me with additional input or whatever you'd like to share with us. If you have resources, if you have ideas, let us know about this. I'm going to ask you one last question here before for the chat box. We want to get a sense, your comments, your overall impressions of where we are with this framework. Are we moving in the right direction with what we showed you today? Is this something we can build on? What are there pieces that you think we should be adding to this? Not specifically under each of the worksheets, but any additional worksheets that we could break this out even more. What are we top line? What are we missing? Is this moving in the right direction for you to be able to continue to provide comments on? I'll just give you a minute to respond. Okay, so we have somebody that likes the continuum of care approach. That's useful. Moving in the right direction. Great. Okay, great. Thank you. Useful process to give input. Yep. Are there any sort of major pieces that you think you'd like us to add or think about or do research on that would contribute to the depth of this continuum? You've given us a lot to think about, a lot to dig into and provide some more research on as we fill this out. Oh, okay, good. Men. Okay, that's great. Somebody suggested that we think about men going through PMADs as well, and it's important not to leave them out of the conversation, getting them screened. Thank you for that. Okay, pathways in terms. Somebody suggested that we think about pathways in terms of reimbursement. So as we add to the spreadsheet, we can start to think about where services are paid for and not paid for by various Medicaid or other. So reimbursement's a good thing to start to think about fleshing this out a little bit. That's helpful. Okay. So I'm gonna hang up now, but I'm gonna leave this open so people can continue to add to this for a while. If you want to add to the chat, I'll leave the webinar open for you to do that. And I'll leave this up so you can take a look, and you want to write this down or go direct to our website. The spreadsheet is there for you to download the PDF, and there's a survey to provide input. And again, there's my contact information. And please feel free to reach out to me if you have ideas or suggestions that you'd like to see us include, or you want to just share some research or some reports with us. Please feel free to email me, and I'll get back to you on that. So thank you very much for your time. This has been useful. I'm sorry it wasn't sort of a better way to do feedback from people, and we would have loved to have a conversation, but we just had so many people that wanted to participate. We're hopeful that this gave you a chance to think about the work that we were doing and give you a chance to sort of take some top-level input, gather the materials, think about this some more when you have some time. And this is an ongoing process, so don't feel like you need to get back to us right away. If something occurs to you over time, navigate back to that web page, our maternal mental health page, and then you can, or email me and just keep us in the process. We'll plan another webinar for the spring, and we'll bring back another draft for this group and let you know what we're thinking again, and any more progress we've made on the other activities of the MOMD project. But this has been very, very helpful to us. Thank you so much for your time, and I will leave this up for you to continue to participate for a while. Thank you. Bye-bye.